So the Gomco procedure is different than the rest of the circumcision methods only because you have a metal device that helps protect the head of the penis when you go to do the procedure itself. So that's part of the reason why I prefer it.
Okay.
I know that I've got something kind of protecting the penis before we cut off that excess foreskin.
Okay.
And that's essentially the reason we do a circumcision, is just to cut off that excess foreskin.
Okay.
So this clamp holds it in there, you'll cut off that excess foreskin, and then to take care of it after, you're really just applying a lot of gauze with tons of Vaseline, and that's just to help protect it as it goes to heal.
Okay.
Because when the penis is healing, it'll form what's called granulation tissue that can adhere or stick to the diaper.
Okay.
And as you're peeling that off, you can imagine that would be hurtful to the infant.
Sure.
So using that gauze with the Vaseline will help protect it, and it's usually about 5 to 7 days for that to heal.
Okay.
And then it all looks fine.
Okay.
There's nothing left over after you finish the procedure that the parents have to worry about in terms of cleaning, other than the gauze and the Vaseline.
Okay.
You don't have the little plastic device that other methods use. So it's a pretty easy, straightforward procedure that takes about 10 to 15 minutes, and that's because you also have to apply the pain numbing medication that we use, which is lidocaine,
Okay.
along with the pacifier with some sweeties sugar to help calm them down.
Sure. Okay. So what should parents look for after? Like, is there any type of drainage or anything? Like
There's a few
discoloration?
things that I usually tell my parents to look for. One is the lidocaine injection that we use for pain management can sometimes leave a little bit of a bruise effect down by the shaft of the penis, so I have them look at that to not worry. We want them to know what's going on. If there's been a little bit of excess bleeding, we might put some gel foam or gel powder to try and stop that procedure too, so I warn them. But with regards to infection, usually there isn't any. We're using sterile equipment and we use aseptic techniques. But if you should see any signs of infection, it would be a lot of yellow discharge that kind of is just pus that kind of oozes throughout, and that you definitely want to be told about right away if you see any signs of that. It's different from the granulation tissue because the granulation tissue is just a certain spot within the area where the adhesions were released,
Okay.
and it stays in that one little area.
Okay. Great. Thank you.
Sure, you're welcome.